Welcome then to this 60-minute session on searching CINAHL databases. So we're looking at the advanced level searching. So this will introduce more advanced search concepts on CINAHL. In particular, we'll look at the combination of keyword and subject searching, as well as saving and rerunning saved searches and creating and sharing custom folders. So some of you may have attended the first part, which is the basic element. This is obviously advanced searching. So I'm Richard Crooks. I work for the EBSCO customer training services team based in Northwest England. So thanks for joining us today in this particular webinar. As always, if you have any comments or questions, please feel free to submit them in the Teams chat. I'll respond as soon as I can. I don't have anyone monitoring the chat for me, so I may be a little delayed in checking those. So in terms of the session itself, by the end of the session, you'll be able to use CINAHL headings to find authoritative search results. You will also be able to use the search history to combine keyword and subject searches. For those, of course, who are on the basic session, we ran keyword searches. So we've had a combination of those two types of searches in this session. You'll also be able to save your results and searches using the personal EBSCO folder. And also with that, you'll be able to create custom folders and be able to share content with colleagues, end users, and so on. And finally, you'll be able to find further help and support information on CINAHL databases. So as with the first session, the basic level session, although we are going to be using the CINAHL version that's available nationally as part of the national core content deal for those who are in NHS England, obviously outside of that, you may have access to CINAHL Complete, you may have upgraded to CINAHL Ultimate, you may have CINAHL Plus with full text, which is available nationally in Wales, for example. But whichever version that you use of CINAHL on EBSCOhost, the principles that we find that we look at today will be applicable across all versions. Okay, so just to clarify that at the outset. So we're going to go straight to the live demonstration. So we'll spend most of the time on the live demo rather than in the PowerPoint. Okay, so let me just do that now. And I'm going to share my desktop with you. So you'll see I've got the advanced search page and I've already authenticated with Open Athens. So I'm here now on the advanced search page and we'll begin our keyword search. So we're going to look at the use of proton pump inhibitors as an intervention for gastroesophageal reflux disease. So I'll begin with the actual condition. So GORD, or otherwise known as GERD, or gastroesophageal reflux disease. And so for that, I'm going to enter the terms in the search box at the top of the screen. So I'm going to enter GORD as an acronym, also GERD, which is used in North America, and also add the Boolean OR here for gastroesophageal reflux. So gastroesophageal reflux. Okay, so we're going to enter the terms like so. We're not going to qualify it with title or abstract field codes. We're going to keep it as an unqualified search. For those of you on the basic level search, you may recall that the help menu on the top right toolbar, if I just open that here, provides you with the definitive fields that are searched automatically when you run a keyword or free tick search. And on this CINAHL page, you'll see searchable fields, and that is explained just above the list of searchable tags or field codes. So again, for CINAHL, you're searching the title, abstract, subject headings, PubMed ID if appropriate, and DOI automatically as long as the author field. So not all of those fields will be applicable. And if you are including the subject headings in this instance, it's a keyword search of the subject index. You are not using the exact heading. So we will combine that with the subject term search. So we'll use these. We may also apply the search within the full text to expand our search results at the keyword free text level. So we covered that in the first session as well. And then we're going to combine it with the subject terms. So we're going to select the suggest subject terms mapping feature above the search box. If within your organization, if you subscribe to a CINAHL database and you do not have that feature shown, it just simply means it needs to be enabled through our EBSCO admin tool, and we can assist you with that. So for the NHS in England, for other NHS organizations, and also for the HSC in Ireland, this feature is enabled, and it may be on or off by default. So here it's on, of course, which means when I click search, I'll be directed to the CINAHL thesaurus, the subject tree, the list of index terms that relate to our keyword search. So you can see, unsurprisingly, we've got gastroesophageal reflux as a CINAHL subject heading. So this term is used obviously to index content, to identify content about this particular condition. Now, if you follow the blue line across, you'll see we've got those three columns, the explode column with the plus sign, major concept, and scope. The scope note will simply just give you the definition or description of that term. Sometimes it'll suggest other terms as well. The major concept, if that was selected, then you would retrieve articles primarily about this condition. Of course, there may be other conditions mentioned, but this will be the primary focus of that research, of that article, book, chapter, dissertation, or whatever is indexed with this term. Now, because we're going to keep it quite broad and then we're going to combine, we'll untick this for now. You'll notice in this example, the explode column, the box there is grayed out. So that indicates to us that there are no narrow headings that will be automatically included when we select gastroesophageal reflux. If you follow the line across as well, you'll see all subheadings are automatically selected. If, of course, you're researching for a paper or supporting a member of the nursing team regarding an assignment, or a dietitian in relation to diet therapy, in relation to GORD, then you could obviously focus on diet therapy here as the subheading. You can see the scope note for this. Okay, and when you do select that, you'll see DH is appended to the actual subject term. So that means we would retrieve references related to diet therapy in relation to this condition from the CINAHL database. However, again, we're going to keep it quite broad. We include all subheadings by default. Also, if you scroll down, you'll see we've got potentially, you often see history notes here, but in this case, we've got related heading. So we've also got heartburn here. So we might want to consider heartburn also as a search term. So we can click search here, we can click heartburn, and we can add that to our search where appropriate. So that's the index search here. Okay, so if we did that, we'll have both sets of terms included. Now we do want to include the keyword equivalents of these terms as well. So if we go back to our term list on the left-hand column, you see we've got GERD or GERD there. And again, we can include that in combination with the index term gastroesophageal reflux. Okay, so again, we're looking for different terms here, and we're going to combine them with a Boolean OR as well. So we've got the two index terms plus the keyword search term. Of course, what we could have done is add heartburn to our original search as well. We can always edit this as well to include that. So if we run it as is right now, just to illustrate the process, and you'll see we've got those terms listed here as well. Okay. So at this stage, we're now looking at the intervention. So as I mentioned, we look at PPIs or proton pump inhibitors like omeprazole, esomeprazole, and so on. So we can search for those terms, again, in a similar fashion. So if we scroll to the top of the screen, we add PPI, for example, as the acronym, the abbreviation. Then we can add proton pump inhibitors. Okay. Or we can actually name them omeprazole or lansoprazole or sorry, I got my caps lock on there. Esomeprazole. So, okay, so we're going to search for all those in relation to this particular element, this intervention. And again, we're going to use the suggest edit terms option. So select that box there, click search, and then we're brought up, this term is brought up, proton pump inhibitors. Now, in this instance, if we select this term, so this is the CINAHL subject heading, you'll see that the explode column is available to be selected, and that's done automatically. So what that's telling us is going to include additional terms that are from the index. And to see those, if you click the term proton pump inhibitors, you'll see how it appears in the subject tree, the hierarchy. So it features under gastrointestinal agents, etc. So you can see here we've got proton inhibitors. Notice it also includes esomeprazole, lansoprazole, and omeprazole here. Okay, and the others also. So by default, when we select explode, it's going to include the narrow or related headings here. Now you may wonder, on this screen, you'll see proton pump inhibitors is selected twice and set to explode as well. Now you may be a bit concerned, thinking, well, if I've got it selected twice, it's going to duplicate records. However, if you look to the right of the screen, you'll see there's only one instance of that index term, that subject term being selected. So what this tells us is that this particular heading, subject term, appears in different elements of the hierarchy within CINAHL. Okay, so again, it's not something that is going to be repeated automatically in terms of duplication, as it were. So we've got that index term selected. Go back to the term list. Again, if we just deselect and reselect again here, and just make sure it's exploded, and look to the right, you'll see again the blue column, all subheadings are selected, and here you can see before 2004, the term is anti-ulcer agents and gastrointestinal agents. So again, proton pump inhibitors is a new or relatively new subject, well, new from 2005 onwards or 2004 onwards. Okay, so that's the term that was used from 2004 to the present. Okay, to identify, articles that mention omeprazole, lansoprazole, etc. So again, we're going to combine it with our search for the keyword search. So we'll select the line at the bottom there, so you can see highlighted in pink. And when we do so, you can see these terms are then added to the search box. They combine with the Boolean OR, so combine selections with OR because obviously they're like terms, but we're running a combination search of the subject search with the keyword or prefix terms simultaneously. So click Search Database, and you'll see those terms appearing in the search history. And just to cover the syntax here, you can see MH indicates this is a CINAHL subject heading, so it's an exact match for a term within the index is the term that's used by indexers to identify, in the case of set 1, items that relate to gastroesophageal reflux, and in set 2, S2, items that relate to proton pump inhibitors. And again, we've included the keyword search terms as well. Okay. As I mentioned, we might want to, add a term or edit this. So I missed heartburn as a keyword search in the first set. So what I can do here, I can just go edit here and I can add that term. So I can just add that here. Let's put it on the end of the search query. So or and heartburn. Okay. So I can run the search for heartburn as well as gastroesophageal reflux, etc., and save that. Okay. So I've added that to that search because I missed it previously. I can also resort our search. So you can see we've got S2, S1. So to reverse that, click search ID in hash above the set number, and we have it in the sequence we started off with. Okay, so sort of detail there, and especially useful if you're going to save the search or have a copy of that for your records to report on. So now what we can do here is combine them. Before we do that, I just want to mention as well, if you do not use the suggest subject terms feature, if you've had that disabled or you simply feel it's not more helpful, you can still perform the same search through the CINAHL subject headings on the top toolbar on the left. So click on that link. And again, if we just did a similar search here, you will see, if I click browse, once again, it brings up the term and I can select both the subject term from the CINAHL thesaurus combined with the keyword search. So again, you have more than one way to do the same thing essentially. Okay. So I'm just going back to the screen here and use search and open the search history. So again, you can, use the CINAHL subject headings link to browse the thesaurus if you prefer to do it that way, or if you prefer to direct your users in that instance, because obviously if you have the suggest subject terms option available and it's on by default, each time a user, a colleague enters a keyword search, it will be mapped to the appropriate index term in CINAHL. And that may or may not be always necessary. Okay, so that's the initial searching, and we'll combine the two sets. So as we mentioned at the beginning, we've combined the keyword search with the subject search. So we've done that for each of these elements, the condition and then the intervention, and now we're combined with the Boolean and here. So click search with and. Okay, and then we have our results below. Okay, so we have this set So we have 1,500 records. Now I'm using the NHS England accounts. As I mentioned earlier, I've signed in, authenticated with Open Athens. So some of you may be coming from other organizations. So some of the links will look familiar to you. For example, request this item is the interlibrary loan form. Get PDF is the LibKey Nomad link resolver. Access item is the full text finder link resolver from EBSCO. View complete issue is the Third Iron browsing journals A to Z service, etc. So you'll see different links here. You'll see some that might be coming directly from the EBSCOhost, which will say PDF or HTML as well. So numerous links there that are available to get to the content or to request it if it's the interlibrary loan form. So we have the results there. And of course, inevitably, we want to save those records or view them later. So at this stage, we can, of course, apply some limiters. We saw some of that in the first session for those who joined. So we've got results published since 1988. That may be going too far back. We may even think about the heading proton pump inhibitor that's been used since 2004, but even that may be too long ago. So we're going to drag this across. And let's just stop. Let's go for the last 9 years. Let's go for 10 years. I usually go for 10 years here, but or we can go for the last 5 years. Let's go for the last 5 years. So 2018. So that'll be from January 2018 to the present. So we've got 344 references now, okay, from the original 1,500. We've got obviously source types. You've got academic journals, magazines. Obviously, we could go for academic journals if we prefer. We have a subject major heading. So again, this major heading would relate to the major concept that you saw in the CINAHL thesaurus. So you can see for each of these items, we have the index terms presented. So gastroesophageal reflux, proton pump inhibitors, etc. Now, there are some instances like item 4. This has not been fully indexed, so this is a pre-CINAHL record. It's been added to the database, but it's not been indexed. So this is coming from Harvard's Men's Health Watch. So you won't see any subheadings listed here. So one disadvantage, if you do use the filter subject major heading, you are going to remove or omit certain references like this where they've not been indexed, because by selecting subject major heading, you are only going to select titles which have been fully indexed, whereby these terms are the major focus for that item that's available, whether it's a journal article, a magazine, a book chapter, and so on. So we're going to leave that off for now. We have got publication as well. So depending on how you want to use this, you could be looking up some articles in relation to this condition from the Journal of Clinical Gastroenterology, for example, or Digestive Disease Sciences. So again, you can choose those. Publisher also is mentioned here. We covered some of this in the basic level searching. We also have language, of course. The majority are in English. So if we prefer to focus only on English language content, then choose that option there. Again, if you've got any comments, questions, or feedback about the interface or searching on CINAHL in this fashion, then please feel free to share that in the Teams chat, and I'll respond as soon as I can. Now, again, just to recap, if you have limited your results, refine them, you'll see each of the limiters have been applied in what we call the bread box. So this is the trial of begin with our search, applying the expander, and then, of course, the various limits there, and latterly English language only. Now, we do have age groups as well. So, of course, in this context, we may be looking for a particular age group, and you will see some references that feature age groups or gender. So item 7 refers to male, female, male, etc. So let's see if we've got any here that has age groups specifically mentioned. Not many at this stage. So this one does actually. Item 13 from JAMA Pediatrics mentions children or child from 6 to 12 years. So the age feature here, the age filter, is really related to the indexing of content in CINAHL. So if you choose an age group here, it's going to limit to that age group, but based on the age group being a subject heading, as it were. So if you choose, for example, all adults, then those 116 references here are going to relate to an adult population, but based on them being already indexed. You can see adult 1944 here. See 45 to 64, so middle age there. So again, it's dependent on the index and content. So once you select that filter, it's going to remove some pre-CINAHL records that you might otherwise find of interest. Likewise with gender as well. And then, as we know from previous trainings, geography relates to country publication. We'll leave it as it is for now, okay? And just scroll to the top. You'll see got the most recent references listed first. However, as we would have known for the previous session, you can sort by relevance as well. And scroll down and you'll see these references. This happens to be just also the most recent as well. Okay, so we have got these references here. And for example, this one here from primary care nurse. And these also can be requested through Interlibrary Loan. And of course, if you are looking at the PDF, then you can get PDF here through Third Eye's LibKey Nomad Link Resolver. Now, of course, some of you may not have access to LibKey or Third Eye. Some of you will be looking at directly at the EBSCO's full text references, etc. You may also go and select, let's see if I can access one here. Access item, again, that's the full text finder link resolver from EBSCO. Okay, so that will give you access to the article typically, as you see there, and this is coming through Progress. So Progress is the provider, but it's using the EBSCO link resolver full text finder, so it's been rebranded. Okay, so you can see there's references there. Now, once we've got to this stage, we might want to save our references, of course. We want to browse them. I won't go through all the look and feel of the records because we've covered that previously. But if you're going to save them, you can click the Add to Folder icon adjacent to each record. And as you do that, okay, they are saved into the folder. Alternatively, click Share, and you can save up to 50 records per page. Okay, so once you've done that, if you scroll to the top of the screen, you'll see the folder has items there now. Okay, as you can see, got these 50 records are now saved. Again, I can still request the item. I can view the PDF, view the complete issue, or I can link through Full Text Finder to access it from another provider, etc., or publisher. So I've got those results there. And of course, I can process these as needed. I can select individual records, or I can select them all here. I can print these as needed. I can also include the current search history, by the way, in the printout. So if I leave it as it is and choose the citation format, Harvard, and click print, you'll see it brings up the screen, okay, with the search history displayed. And you can see that from this print menu here. And this also allows me to save this as a PDF or send it directly to my printer as needed. Again, I can change the formatting here, the layout. So you can have a copy of the records you've saved in addition to the actual current search history. Okay. Now, alternatively, you may want to use the email option, and this is all without signing in, by the way. And if you are in NHS in England, then you will be signed in to your folder automatically through the EBSCO single sign-on. So at the moment, I've got sign into my EBSCO, which means I'll need to go through the process of entering my credentials to log in, authenticate to my folder, and then I can view these at a later time beyond this session. I can select these, of course, again, email them. And when I do email, you'll see the options. You may have seen this in Medline or other databases on the EBSCO interface, but just to clarify for those who have not seen them, you can add, of course, multiple email addresses here, so you can send this to more than one person. You can opt for plain text as a rich text format. You can choose to include the HTML full text, PDFs as separate attachments, as well as the current search history. Now, I generally untick PDF as separate attachment because you don't want numerous emails appearing in the recipient's inbox in relation to this search. You may just want to send one email with the current search history attached as an HTML page, and then any HTML included, although you can untick that as well. Then, of course, you can choose the citation format. So if you're working within Harvard, which is the commonly used format within the NHS, although there are variations. So again, we would advise users to consult yourselves in terms of how to render each citation, okay, for the exact formatting. There is a customized field format as well here. So if you were to send that, then that would be confirmed as going into my inbox, and I'd have those references to review later, and also to check the search history as well, to review the search strategy today. So that's the email manager. I won't cover save as a file. That's essentially saving as an HTML page, etc., or alternatively as PDF. We have the export option here as well, so you can select these and export into the likes of EndNote, as you'll see in a moment. Reference Manager has been discontinued, I believe. Zotero, we've got EndNote Web, which will be the equivalent of EndNote Online. You've got BibTeX if you work in the university sector, and you've got RefWorks there as well, among some others. So you can save in that format as is appropriate, depending on what software you're using. And probably the RS format or RIS format is the most commonly used direct export. So basically, you can export these references that can then be viewed, screened, etc. in the preferred bibliographic software. Okay, so right now I've obviously gone through these references. I have them in my folder, but say, for example, I've not had time to review this content. I want to review it. Maybe I need to run another search, another iteration of the search, or I may want to switch to another database like Medline and run a similar search and save them to this folder. So if I want to keep these records beyond the session, I need to go to sign into my EBSCO. Again, in England, you'll be signing automatically to a folder. It'll be created for you, as it were. And then you'll see now I am signed in. Okay, so I've got more references there stored. Okay. Okay, so I'm signed in. So that means these references are here to stay, as it were. If I close my browser in error, I can come back and those references will still be there. Okay, if the session times out, which is typically 2 hours, then if I come back 2 hours later, I'm signed out, I can sign back in, go through OpenAuthINS, sign into the EBSCOhost database, in this case CINAHL, go into my folder, and they will be here. Okay, so they'll be saved beyond the session. So what it also means is, well, I'll come to that in a moment, actually. Let me part that thought about the folders, which I was just going to share with you. It also means you can create custom folders. So, and firstly, well, let me say you can save your search. So in order to save a search within CINAHL on EBSCOhost, you do need to be signed into the MyEBSCO folder. So at this level, you can, of course, print the search history directly from this page, and you can see the set numbers there, etc. And it's also date stamped as well. So you can print that. You can also save the search alerts here, and then you have the search history below. So at this stage, we can still apply other filters, or we can make corrections to the search itself. Just go to the edit column, the action column with edit, and then you can make any changes that need to be made in terms of the search that you've run. Okay, so you can still make changes before you save the search. If you're satisfied with that, then you can actually save the search. So if you put in Gord and PPI, and I'll put, okay, let's put 10/23, October 2023, and we can set permanently or for 24 hours. Obviously, if you're working your way through, you stop at lunch, you want to come back to it, then 24 hours is sufficient, of course. If you are concerned you may not be able to get to it sooner than that, maybe tomorrow afternoon is the next opportunity you have to work through this search, then obviously save it permanently and then click save. So you get the confirmation on screen that the save search has been modified. It's been saved. It's date stamped, of course. You can see we've run this in CINAHL, and we click continue. Once you click continue, you're taken straight back to the save searches folder, and we have this folder stored here. You can go back in to edit the save search if you want to make changes to this. It could be the name of the search. It could be you want to switch from temporary to permanent, or you simply may want to edit the search strategy based on more information, etc. So you have that option there. Also, you can rerun it as well. So obviously you can see retrieve save search here. So if you go to the new search page, if we go to search history and we clear the search history, we delete this here, go to new search again, and then go to folder. And then we go into our save searches folder and we can select and rerun. Now, it'll rerun on CINAHL because I'm viewing CINAHL, but if I was in Medline at this stage, then the search itself will be rerun on Medline, not CINAHL. So just remember that it will rerun on the database that you're viewing at that time. So the MyEBSCO personal folder is shared across all EBSCO's databases. So if you create an account in CINAHL, then you can use that account also in Medline as well. Okay, and of course, for those who work in England in the NHS, you also have psychology, behavioural sciences collection on the EBSCO interface. So you have one folder account for those 3 databases. But be mindful, although the search was saved, having run it on CINAHL, when you rerun it on another, it will rerun on another database if that database is open when you select to retrieve it. Okay. So just be mindful of that. Now, in addition to saving your search and saving articles, you can create your own custom folders. So on the left-hand column, you'll see I've got this one, nursing, currently under my custom. So if I click new here, I can actually give a name for this condition, like GORD. I call it GORD and PPI. Okay, so this is the topic I'm researching. This is the evidence search, as it were. I can save this. And what I can do now, so you can see that appearing on the left-hand column, I can then select, or, I can copy or move. Now, I would say copy is a good option, because what it means is if you copy these directly to that folder now, okay. I think it's just got a bit behind me at this stage. So let me try that again. So I think it's just to do with the server, I think, slowing down here, because it's not allowing me to do that. So I can move these, for example. Now let me come back out of this. I think it's just the caching on Chrome that's causing a problem here. So I click new search. I go back into my folder. Again, I can select these terms, these articles. I can select copy, and I can save to my folder. So copy them across. So the articles are still there, still in my folder. But if we scroll down and look on the left, you'll see now for my GORD and PPI folder, I've got 2050 articles. So the same articles are now stored in my custom folder. This then means I can then select and email these references to the preferred recipient, in which case it'll be me at this time. So just wait, let's go through, and I can add my email address there. You can add multiple email addresses again there. I can untick HTML, PDF, leave the current search history because I want the record of that attached to the email. Choose my citation format, Harvard, and I can also select remove these items from the folder after emailing. So what this means is I can send a list of results to a recipient to include the current search history, assuming that they will open that, look at that content. So I'm just going to click continue here. But if it goes astray, if it ends up in the junk mail folder, spam filter, it gets blocked, or the user, the recipient, simply deletes it but in error, I can go back in to my custom folder. Those 50 articles are stored there, and I can repeat the process, select these, and I can email them. Okay, so you're basically creating a backup when you copy them to a folder. Of course, you can move them as well. So again, I chose to copy them because I was going to send them to through the email manager. But if you're just simply going to select them, then you can select these and move accordingly. Okay. Now, another thing to note, when you create a custom folder, when you are searching, whether you're using Medline or CINAHL, and CINAHL in this case, of course, then what will happen if you go back here, if you look at the search history, and again, choose the results here, so go to view the results at the bottom there. Then when I go to save a record, so I'm going to deselect here, I can save directly into the folder. Okay, so once you're signed into a personal folder and you've created some additional subfolders like nursing, GORD, and PPI, you can save that reference directly into that folder. Okay, as you see there. So again, it's your decision whether you do one or the other first. So in principle, you could say it's better just to create the folder account or use the folder account, set up custom folders, and then when you are running a search, you can then save items directly into the folder. Okay. Now you can also share content from the folder. If I go to the folder again, okay, so just going to check that now. What you can do here is just go to that folder again, and you'll see there's a share link. So under GORD and PPI on the left-hand column, we click share. And this is where I can invite any of you, other colleagues, to access that content that I've saved. So I can add the email address here. I can say, please go to my folder to view the latest articles. Thank you. Okay. Now I've got this option to restrict passcode to single use. I would untick this because otherwise any recipient, any person who's invited to access a folder, whenever they go into their own account and they'll see this option to add on the bottom left there, they'll be required to add the passcode to access on a read-only basis that content. So if you have this option, restrict passcode to single use, each time the person wants to view the latest content you've saved, they would need to enter the passcode. So that wouldn't be very helpful to them. So I'd untick this, I'd invite them, okay. And in terms of this, if we go to share again, or sorry, not share, if we go to add, you'll see the kind of passcode that's generated and you'll find that in your email, in your inbox. So essentially, anyone who wants to access read-only content in a folder that they're invited to, they must have a personal folder account. So both the sender, the one inviting, and the one invited must have a personal EBSCO folder account. So essentially what it means is, rather than emailing, printing, etc., content that you've saved from a search, you can actually share it with the recipient by inviting them to access that personal folder, okay, that custom folder. Now, they can only see the articles on a read-only basis if you move the saved search here, which I'll do now, to the folder, as it's the same topic. That will appear on the left-hand column under the GORD PPI folder. So both the 50 articles and the saved searches are included, the saved search. However, in terms of invitation, the person invited or the persons invited will not see the saved search. They'll only have access to the articles on a read-only basis. They cannot delete, they cannot remove. If you do want to share the search with the user, then you can go back to the result list. So we go back a step here. Go to the search history. And then if I scroll down and look at the results again, and go to share, and you'll see add search to folder S1 and S2. So we remember we combined our search for gastroesophageal reflux and related terms with proton pump inhibitors and related terms, a combination of keyword and subject searching, and we've come up with a set. So S1 and S2. If we go into the folder, you'll see this is the link, this is that link. So essentially, it creates the link, the URL for the search. So you can paste that into your browser to run the search. Specifies it's run on CINAHL, and it's with content from 2018 to the present. Now that persistent link can also be copied or moved to our folder, to the custom folder. So when we do that, you'll see it's now stored there as well. So we have the articles, we have the persistent link to the search, and we have the saved searches. Now, in terms of sharing, the persistent link to the searches is also available. So when a recipient is invited, when they access the folder, they will see the articles and they will see and have access to that link. They will not be able to see the saved searches though. Okay, so that's the general approach to that in terms of creating custom folders and sharing content. So again, any questions or comments about this, please do feel free to post that in the Teams chat. We are well within time, so we do have time for questions or comments or any feedback. And if I need to unmute you, then please do select the raised hand icon. Okay. So obviously we've run a search, we've limited it to a degree, we've saved articles, we've saved our search, and we've also created a custom folder with these articles with the search. We've then gone and saved a link to the search, which we then moved to the folder so that can be shared along with the saved articles as well. Okay, so these are the steps we've taken. Okay, now obviously we do have a lot of support information on using the interface and using CINAHL. So we do have the help menu online on the top toolbar on the right. So I just go back there again. So this is generic across all EBSCO's databases. You have the advanced search guide style page, which we've been using. Okay, so you can use it in like fashion as well. We have references to the search history here. Also combining terms also with the tutorial associated there as well. We have the use of the result list. And of course, we didn't cover in this session truncation, wildcards, proximity search operators. We cover that in more in-depth sessions when we're looking at systematic literature searching in Medline, as well as supporting certificate reviews for CINAHL and Medline. So again, we cover some of those additional features in those webinars. So the result list there, etc. Then there's the using the folder option as well. So again, references to using the folder with the EBSCO tutorial included here. And then also for managing custom folders, I've shown you how to create a custom folder, why you might do that. So it's similar to what you'd use Outlook in terms of creating additional folders in addition to the inbox so that you can obviously navigate and identify content more easily. So you can create a folder in relation to a person or a topic or a department, etc. And then we've got also the reference to sharing a folder as well. So we have that information available. Again, we still have the printing email options there as well. And then we have the direct database help for CINAHL, and we have more information on searchable fields, etc., including the field codes that you would use, which we cover in other sessions as well. And it also includes, go back to the top, the definition of fields for each record as well. So if you're not clear what is meant by the keywords, then you can refer to this element, or if it relates to the instrumentation, again, you can refer to the appropriate entry there on this menu. Now, of course, we have EBSCO Connect, our support portal. If we scroll down, then you'll see there's the reference there to EBSCO Connect. This is connect.ebsco.com, and on here we'll have the tutorials on EBSCO interfaces, and that, of course, includes CINAHL Medline. So we've got the EBSCO's research database tutorials with the various areas, functionality we've covered today, such as using the search history. So that's available through YouTube with the associated PowerPoint as well. Okay, and then going back, we also have within the clinical decisions tutorials, so that relates to CINAHL Medline, we also have the reference to CINAHL and mesh headings as well. So we have focused, of course, on CINAHL in this session, and we have looked at how we can incorporate the subject search, the CINAHL subject headings in our search. So we're not relying solely on keyword or free text search terms. We're also factoring the actual indexing of content within this database, as we saw with the example of gastroesophageal reflux and PPIs as well. But again, there's a tutorial which goes through the steps to include the subheadings as appropriate. Okay, again, just to, if some of you may not be aware of this, if you are, apologies for repeating this as we cover this in other sessions, but we do have the learning link there to Learning Management System from EBSCO, and within here we have the e-learning paths, which includes one for CINAHL. So if you're new to CINAHL, if your colleagues who just started, maybe they've transitioned from academia to healthcare, then there is a e-learning path on CINAHL. Again, this will be applicable across all versions of CINAHL, and that will allow you to take these courses in your own time, at your own pace, once you've signed up for them. So you do need to register for these courses. So you can see here, set one on CINAHL headings there, which could be of interest, especially in light of this session. So you don't have to take the whole course, of course. You may just want to take bits and pieces. These are intended for library staff, by the way, not intended for nursing staff or other healthcare professionals. So they are library staff specific. So you can sign in for these as needed, and that means you would either sign into your account if you have one already, or you'd request an account in relation to using EBSCO Connect. We do have the training resources portal as well, so I'm just going to go there briefly with additional information and also training videos. So this, along with other recently recorded webinars, will be hosted on this platform in due course once it's been edited. So when I send you the link to the recording and the PowerPoint, that link will come from our YouTube channel for the UK at EBSCO. Okay, you can see numerous courses there that I've run previously that are accessible. We also have, of course, upcoming training sessions. So I have scheduled some more sessions for November. I'm always open, of course, to new ideas about trainings, but you see some of these that you can go to. For example, this one on Medline on EBSCOhost. And we have a session in October and also November for that session. So again, these will be advertised in due course as well. Support information will be EBSCO Connect again. We do have a dedicated section on resource materials on the top right there, and that will give you access to tutorials, help sheets, guides, etc. So if you go to the topic, choose CINAHL, apply it, you'll see in a moment, we've got this one on this help sheet on advanced searching with CINAHL subheadings. Okay, there's an advanced searching tutorial, there's a takeaway guide, etc. And so on. Again, there's this using CINAHL mesh subheadings. And again, you can go through to the actual sheet itself. Okay, again, using suggested terms and explaining how that operates within EBSCOhost. We do have, again, links to EBSCO Academy, EBSCO Connect, and also promotional materials as well. So if you're looking to raise awareness, then you do have the option here as well. Okay, so just some guides there as well. Of course, you can narrow it down to CINAHL specifically. Okay. And then you can scroll through to the appropriate version of CINAHL that you're using. And this is the takeaway guide for the CINAHL abstract and index only version of the database. Okay, so I'll stop there. I'll go back to the search history, back to the screen for the search. Okay, and I'll stop sharing and go back to the PowerPoint and begin to conclude the session as needed. I've included the PowerPoint, some key documents and links to tutorials, plus the help sheets and frequently asked questions in relation to some of the elements that we've looked at today. Again, as a reminder that we have the NHS resources.stacksdiscovery.com website, the Healthcare Training Resources portal for more information on training, recordings, upcoming sessions, links to EBSCO Connect, EBSCO Academy as well, and also promotional materials. And then in addition to that, of course, EBSCO Connect is the main support portal, which gives you access to the tutorials and also the link to Learning Academy. So EBSCO Academy with the webinar recordings, e-learning paths, and also additional training courses, which are available through our Zoom portal. So not all of you I know can use Zoom. We do have, again, the Learning Academy, the EBSCO Academy CINAHL course available. So you can take that in your own time. So that also features videos, quizzes, and links to support information. So if you're new to CINAHL, that's probably a good starting point. And of course, I have my Calendly page for additional trainings. You can book the public sessions that I run, such as this one, as you've done. You can arrange a core consultation with me. You can also schedule a customized online training as needed. So there are automatic confirmation, notifications, etc. as well. So these are run on Teams, but for the customizable ones, you can request Zoom as well. So this is an example, supporting system reviews using EBSCO's Part 1. So this is the searching, and this will cover the likes of proximity search operators, wildcards, truncation, and so on. Okay, so again, you can select that in your own time as needed. So we are a good few minutes away from the finish, but I'm happy to conclude early if necessary. But this time I want to check if there are any questions or comments, or if I need to review any of these elements today that we've covered this afternoon. So any comments or questions regarding what we've covered today? Yep, that's right. I agree, Emma. It's a case of soaking some of this in, exploring it yourself in your own time. If you've got any questions, then please feel free to contact me, and I'll leave you my contact details, ourcooks@ebsco.com. If you have any training related queries, then you may submit them through eurosupport@ebsco.com. You may even submit a ticket through the NHS service desk for those of you who are in England. So often they will take care of queries initially and escalate them to us as needed. But obviously, by all means, feel free to contact me directly regarding any questions or comments in relation to this training. Okay, so I'm happy to conclude here. Don't see any more questions. So thanks again for joining us and enjoy the rest of your day. Thank you very much.